In other news tonight, we're on your side with the WBRC Safety Check, helping you know when it's time to start asking questions about what healthcare providers are putting into your body.
Investigators say an IV and wellness clinic in Cullman was accused of misleading clients and injecting them with drugs that were not approved for human use. Your reporter James Giles sat down with the State Board of Medical Examiners. And James, how can we protect ourselves according to them?
Well, Steve, Brittany, it's unfortunate we even have to have this conversation about this, but I'm told these cases are happening more often. Experts say there are warning signs, though, you can look out for if something feels off.
Most people trust doctors and nurses to have their best interests at heart. But for some patients at Aurora IV and Wellness Clinic in Coleman, that trust may have been broken.
And whenever we hear of deceptive practices or any sort of honesty issues or anything like that, the board takes a very serious look at that.
The Alabama Attorney General is now moving to shut down the clinic in 2 other locations. A whistleblower claims they were injecting clients with a weight loss drug meant for research use, not approved for humans or animals.
And sometimes the best interest may be to tell you no, or something you don't want to hear.
Wilson Hunter with the State Board of Medical Examiners says cases like what we're seeing in Coleman are becoming all too common. He says there are simple red flags to watch for. 1, if the clinic has a menu of treatments and only takes cash, be cautious.
If you go into a place and they're basically saying, you tell us what you want and we'll give it to you, you should be on alert that they're there to sell you something.
Another sign, if a provider offers something your primary care doctor wouldn't, or for a price that sounds too good to be true.
I think you ought to have a concern that that person has cut a safety corner somewhere.
Hunter says some clinics even mix cheaper research-grade drugs with vitamins like B12 to make them seem legitimate.
The way the law is written, that's a new drug, and so they can then set a new price. If they're offering you a GLP-1 plus something else, an additive, that means it's compounded, and you should then start asking questions about whether or not it's pharmaceutical grade or not.
Now, Hunter says before any injection or treatment, take a minute to look up your provider's record. A license doesn't always mean a clean history. Later tonight, we'll post a link to the state's physician lookup tool. You can find that in the WBRC News app.